Hi everybody, this is Stephanie Christensen, and these are my two areas of the brain I'm talking about. My first area is Wernicke's, which is located over here. Wernicke's area is a functionally defined structure that is involved in language comprehension. In about 90% of humans, major language functions are contained in the left hemisphere of the brain, and for most people, Wernicke's area is lateralized to the left side. It takes its name from Carl Wernicke, who worked with language-impaired patients to distinguish separate regions for language comprehension and production. In a case study, Howard Gardner's The Shattered Mind, the author compares case studies from two patients, one with Broca's aphasia and one with Wernicke's aphasia. Broca's aphasia is speech that is not fluent and lacks grammar, such as, I am Sig, no man, well, again. These words were emitted slowly and with great effort. The sounds were not clearly articulated. Each syllable was utterly, harshly, explosively, and throaty voice. Wernicke's aphasia is more like this. I've done a lot well. I impose a lot while the other hand, you know what I mean. I have to run around, look it over, troublin' and all that sort of stuff. Oh, sure, go ahead, any old think you want. If I could, I would. Oh, I'm taking the word the wrong way to say. All the barbers whenever they stop, you're going around and around, if you know what I mean. Associated functions with this Wernicke's is language comprehension and disorders. Wernicke's area has not been strongly associated with any cognitive disorders. A small number of papers report abnormalities in schizophrenic patients, but these have not been widely replicated. So associated damage with this area would be Wernicke's aphasia, which is characterized by inappropriate words and inability to understand spoken language. The major deficit in Wernicke's aphasia is synchronizing objects and ideas with words that signify them. Okay, so my second area is Broca's area. Broca's area is a functionally defined structure in the left frontal lobe of about 97% of humans. Broca's area is involved mainly in the production of spoken and written language, and is also a language processing and comprehension. It takes the name from a French scientist whose work with language-impaired patients led him to conclude that we speak with our left brain. In the 1960s, Roger Sperry and Michael devised an ingenious experiment to determine whether language was lateralized to the left hemisphere. They worked with split-brain patients. Using the left hemisphere, split-brain patients could produce the name of objects held in the right hand without difficulty. Amazingly, if you held the same object in the left hand, the object would not be named. Associated functions is language production, comprehension of complex syntax. Disorders, language impairments, and autism may be related to abnormalities in Broca's area. Damage to this area would be Broca's aphasia, repetitive speech, disordered syntax and grammar, and disorder structure of individual words. And also a really cool thing on a side note that I just learned was that when someone has a stroke and say it affects Broca's area, sometimes they have aphasia and cannot speak anymore. However, the right side of your brain, your right hemisphere, it actually is the area where you sing. So what a lot of speech therapists are doing, if the patient is a candidate for it, is to teach the patient to sing. And then once the patient has been able to learn how to sing again, they teach them how to talk sing. So that way they can at least communicate with their families. But that's my stuff. Thank you so much.